Hello everyone. Based on our previous video regarding the orientation of the upper limb, you know about the various topics that we'll be covering in the entire series of our upper limb, among which and very important LAQ, उसी के साथ साथ क्लिनिकल क्वेश्चंस जिससे आते हैं और मेक श्योर ECE में या फिर अपने जो भी केस बेस्ड क्वेश्चन है उसमें से आपको इस चैप्टर से डेफिनेटली एक क्वेश्चन तो पक्का आ रहा है. दैट इज आवर मैमरी ग्लैंड. Mammary gland maybe we have a very important clinical question, that is our breast cancer. So talking about our mammary gland or the breast, basically it's a modified sweat gland. Please, I repeat once again, please pay attention that it is a modified sweat gland. Okay, you'll be generally confused in the MCQs by stating that mammary gland is a modified sweat gland or a modified sebaceous gland. So it's a modified sweat gland. The modified sebaceous gland is present in the areolar region of the mammary gland. I'll come to that point afterwards. Talking about a mammary gland, it is a modified sweat gland, which is basically rudimentary in males. Now, you all know this much. Now, whenever you are describing an organ, make sure that first you describe its location, its shape, and its extent. Okay? So, talking about our mammary gland, the mammary gland or the breast lies in the superficial fascia of our pectoral region. Pichla video was based on the orientation of the pectoral region, where I have very well explained about you ki kya kya hai superficial fascia or wo sab. So our mammary gland lies in the superficial fascia of the pectoral region. Okay. Now talking about the mammary gland, we can see a very small extension into the axilla region. This extension is called as the axillary tail of breast, या फिर the axillary tail of Spence, and the opening through which the axillary tail of Spence passes into the axilla is called as the foramen of Langer. Now, once again I am repeating, if we see, our breast basically lies in the superficial fascia of our pectoral region. This breast has a small extension which is called as the axillary tail of Spence into the axilla region through an opening that is called as the foramen of Langer. You have various terms that you have to remember while studying the breast region, and these terms the examiner makes sure that he asks you in the viva, या फिर ये common terms जो आपको पता होने ही चाहिए. Okay, so till now we have discussed about the foramen of Langer. In the end I will revise all the terms once again. So our first term is the foramen of Langer. Foramen of Langer. Now, moving on forwards with our mammary gland, the shape is variable. It can be oval in shape, flat, pendulous. That is, pendulous shape means which is hanging very loose. या फिर pyriform in shape. Talking about the extent of the mammary gland vertically extends from the second rib to the sixth rib. Vertically from the second rib to the sixth rib. Whereas horizontally you can see its extension is from the sternum, being more specific, lateral border of the sternum up to the mid axillary line. So this diagram will very well explain you the the extent of the mammary gland. उसी के साथ साथ one basic feature, that is the extension into the axilla through the foramen of Langer, that is called as the axillary tail of Spence. Okay. Now what are the relations of the mammary gland? यहाँ पे तीन मसल्स है बेसिकली, दैट इज अपना पेक्टोरालिस मेजर मसल, serratus anterior muscle, and the oblique muscle, that is the external oblique muscle of our abdomen. यहाँ पे अपना pectoralis major होगा, serratus anterior, and this is the external oblique muscle. I'll see if I have any. हाँ, ये रहा. So talking about the deep relations, तो muscles में हमारे पास है pectoralis major muscle, here is our serratus anterior muscle, and here is the external oblique muscle. So along with the deep fascia and these three muscles form the deep relations of the अपना breast. उसी के साथ साथ there is a retromammary space. I forgot to add here. There is this retromammary space. Retromammary space. Retromammary space. Now, what is the importance of this retromammary space? This retromammary space is formed by the loose areolar tissue is formed by the loose areolar tissue. It separates, it separates the breast from the pectoral fascia. It separates the breast from the pectoral fascia. Okay. So because of the presence of this loose areolar tissue, our normal breast in the females can move over the pectoral fascia. Now, what is the importance of this retromammary space? In the breast cancer, your breast does not move. So that is, it shows if your breast is moving freely, that means you have the normal breast. That means you are cancer free. But in the cases of the breast cancer, the breast becomes tight. This loose areolar tissue basically diminishes, because of which there is no free movement of the breast over the pectoral fascia. So that is an indication of your breast cancer, one of the most important signs that are seen during your breast cancer. Okay. So this was about, a quick revision towards your, a quick view toward the theory wala part. Location अगर हम देखेंगे, superficial fascia of the pectoral region and extension into the axilla through the opening which is called as the foramen of Langer. Extension को हम बोलेंगे axillary tail of Spence. Extend vertically second rib से sixth rib or horizontally from the lateral border of the sternum to the mid-axillary line. From the lateral border of the sternum to the mid-axillary line. Deep relations में pectoralis major muscle, serratus anterior muscle and external oblique muscle. Okay. Moving on to the structure of the breast. अगर LAQ आया तो तुम्हारा पैटर्न क्या होगा LAQ लिखने का? First you will give an introduction that the mammary gland or breast is a modified sweat gland which is rudimentary in males. नेक्स्ट पॉइंट में हेडर डाल लोगे तुम लोकेशन में तुम ये सब चीजें लिखोगे. नेक्स्ट हेडर एक्सटेंड में ये सब आएगा. उसके बाद डीप रिलेशंस जिसमें हमें डीप फेशिया एक इंक्लूड करना है. उसके बाद 3 मसल्स लाइंग डीप टू दी ब्रेस्ट और उसके बाद हमारा रेट्रोमैमरी स्पेस. उसके बाद टॉकिंग अबाउट द नेक्स्ट हेडर, इट विल बी बेसिकली अबाउट द स्ट्रक्चर ऑफ द ब्रेस्ट. नाउ द ब्रेस्ट कंटेन्स 3 मेन कंपोनेंट्स व्हिच आर स्किन, स्ट्रोमा and the parenchyma. Skin, stroma and the parenchyma. Skin के अंदर we will learn about the nipple and the areola, whereas stroma is basically of 2 types. One is fibrous and the other one is fatty. This parenchyma is the main. Parenchyma is our main mammary gland. Parenchyma को ही हमारा mammary gland भी कहा जाता है. ठीक है. Coming on to the skin वाला part. Do you have a diagram? Yes, I have a good diagram for this. To just search it. ठीक है. This is the breast cancer वाला. But अगर हम देखेंगे कि ऐसे normally ऐसे नहीं होता. This is in the cases of the breast cancer. But the middle वाला part is called as the nipple, whereas the surrounding, the darkened part around the base of the nipple, which is pigmented, is called as the areola. Okay. So, in our breast, nipple forms the center part, whereas the areola is the skin which is darkened around the nipple. So, this is our nipple, whereas this is our areola. Talking about the nipple is basically a conical projection which is present at the 4th intercostal space. 4th intercostal space. Second rib और यहाँ पे होगा 6th rib, second rib, 3rd rib, 4th rib, 5th rib. तो ये होगा अपना second intercostal space, 3rd intercostal space और ये अपना 4th intercostal space. तो अपना nipple lies at our 4th intercostal space. Nipple lies at the 4th intercostal space. Now this nipple, as you can very well see in this diagram, that it is pierced. ये जो भी लेके आ रहा है, this nipple is pierced by 15 to 20 lactiferous ducts. What is this? These are the lactiferous ducts. So you can see that this all open into the nipple. Now, nipple is very rich in the nerve supply, as along with it contains the circular and the smooth muscles. Now, talking about the nipple once again, a quick revision that it is conical in projection, lies at the 4th intercostal space. 15 to 20 lactiferous duct open into the nipple. It is very rich in the nerve supply. It has the longitudinal and the circular muscle. So ये होते हैं हमारे निप्पल के 4 पॉइंट. ये देखो. Covers skin, covers the gland and shows the following feature. It has the nipple and the areola. Nipple हमारा एक conical projection है, present just below at the center of the base, at the center of the breast, at the fourth intercostal space. It is pierced by the 15 to 20 lactiferous duct. It has circular and the longitudinal smooth muscles. It is rich in the nerve supply. तो ये हो गए हमारे 4 पॉइंट निप्पल के बारे में. ओके. इसके बाद अगर तुमने ये डायग्राम बना दिया ना, सिर्फ इतना, एग्जामिनर इम्प्रेस्ड, मार्क्स मिलने के ज्यादा चांसेस. ओके. उसके बाद एरियोला. एरियोला क्या है हमारा? तो एरियोला द बेसिकली इट इज द स्किन सराउंडिंग द बेस ऑफ द निप्पल. नाउ दिस एरियोला is basically pigmented. This areola is pigmented. अब ये जो पिगमेंटेड है वो हम देखेंगे. दिस रीजन, द एरियोला रीजन, से मैंने पहले भी बताया था, इज वेरी रिच, इन दी सिबेशियस ग्लैंड्स, और ये जो सिबेशियस ग्लैंड्स है ना, ये भी बेसिकली एरियोला के आउटर मार्जिन पे ज्यादा होते हैं. Once again repeating the entire point. This areola is basically the pigmented structure present around the base of the nipple. This areola is very rich in sebaceous gland. This areola has modified sebaceous glands which are particularly along the outer margin of the around the breast. So this अपने sebaceous gland, this get enlarged during the pregnancy. अब ये जो हमारे sebaceous glands है, this get enlarged during the pregnancy, and this are then called as the tubercles of Montgomery. ओके. ज्यादा हैवी हो गया तो वापस एक बार रिपीट करता हूँ. जो हमारे निप्पल के बाजू में हमारा पिगमेंटेड एरिया, दैट इज कॉल्ड एज आर एरियोला. दिस एरियोला इज रिच इन द मॉडिफाइड sebaceous gland. These sebaceous glands are more in number along the outer margin. This gets enlarged during the pregnancy, which are then called as the tubercles of Montgomery. Okay. So यही सब पॉइंट्स मैंने यहाँ पे लिखे हैं. Surrounding the base of the nipple, pigmented, forms a circular area called as the areola, rich in the modified sebaceous glands, particularly around the outer margin, becomes enlarged during the pregnancy, called as a tubercle of Montgomery. Skin of the areola and then ये ठीक है. ऑयली सिक्रेशन. अब ये sebaceous glands का काम क्या है? sebaceous है तो ये क्या सिक्रेट करेंगे? ऑयल. Now this oily secretions basically lubricate the breast and prevents the cracking during lactation. जब बेबी ब्रेस्ट से मिल्क ले रहा है, सक कर रहा है बेसिकली, तो ब्रेस्ट में जो है वो क्रैकिंग ना है, उसके वजह से जो ऑयली सिक्रेशंस है अपने ट्यूबरकल्स ऑफ मॉन्टगोमेरी के, वो हेल्प करते हैं उसको लुब्रिकेट करके. Skin of the areola and the nipple is devoid of hair. This color of the areola becomes more darker during the pregnancy. Talking about the stroma of the breast, the stroma basically forms a fibrous network, basically forms a framework of the gland. Stroma forms the framework of the gland. So, in the stroma, if you see, अगर इसे डायग्राम से मैं एक्सप्लेन करूं, this yellow वाला पार्ट is basically हमारा fatty stroma, whereas बीच में जो ये आपको extensions दिख रहे हैं, that is हमारा fibrous stroma. So this fibrous stroma basically अगर हम बोलेंगे तो जो हमारा fibrous stroma होता है ना, वो ऐसे septas फॉर्म करता है. Now what are the septas called as? They are called as the suspensory ligament of Cooper. या फिर Cooper, suspensory ligament of Cooper. Now this ligaments, what is the function of this ligament? This ligament basically, अब इसके ऊपर skin होगा. This ligament anchors the skin to the अपना main pectoral fascia, which is important to maintain the shape of the breast. तो यहाँ से इमेजिन करिए ये स्किन है, उससे ये जो फाइब्रस अपना लिगामेंट्स ऑफ कूपर है, दैट अटैचेस द स्किन टू द पेक्टोरल फेशिया, ताकि जो शेप है ब्रेस्ट का वो बना रहे. अगर हाँ, कैंसर वाले पॉइंट में वापस आऊंगा इनके पास. सो टॉकिंग अबाउट दिस स्ट्रोमा, और इसका जो ये फैटी वाला पार्ट है दैट फॉर्म्स द मेन बल्क ऑफ द जो हमारे बल्क होता है ब्रेस्ट में, दैट इज बेसिकली फॉर्म बिकॉज ऑफ आवर फैटी स्ट्रोमा. वेराज जो हमारा शेप मेंटेन करने के काम आता है दैट इज बिकॉज ऑफ आवर फाइब्रस स्ट्रोमा. ओके, नाउ मूविंग ऑन. हाँ, ये वही सब लिखा है मैंने. फाइब्रस स्ट्रोमा फॉर्म्स सेप्टा जिस कॉल्ड एज सस्पेंसरी लिगामेंट ऑफ कूपर. उसके बाद विच एंकर्स द स्किन टू द पेक्टोरल फेशिया whereas the fatty stroma forms the main bulk. हाँ, कमिंग ऑन टू दी कौन से हमारे को वर्ड्स याद रखने हैं. एक तो हो गया हमारा फोरामेन ऑफ लैंगर. उसके बाद है हमारे पास ट्यूबरकल्स ऑफ मॉन्टेगोमेरी. ट्यूबरकल्स ऑफ मॉन्टेगोमेरी स्पेल हमने पूरा कहाँ लिखते बैठू, मॉन्टेगोमेरी. उसके बाद है हमारे पास लिगामेंट्स ऑफ कूपर. ओके, moving on forward with our parenchyma. This parenchyma is the main mammary gland. It is an compound tubulo-alveolar gland. Breast is a modified sweat gland. Areola has modified sebaceous glands, whereas अपना parenchyma is a compound tubulo-alveolar gland, which is again a modified sweat gland. अगर हम बात करेंगे हमारे parenchyma की, so it has 15 to 20 lobes. अब ये हमारे lobes है, ये lobes है हमारे. Each lobe has a cluster of alveoli, ठीक है, which is drained by the lactiferous duct. ये हमारी lactiferous duct. Each lobe is drained by the lactiferous duct. This lactiferous duct altogether converge towards the nipple. जैसे हमने पहले भी बोला था कि the nipple is pierced by the 15 to 20 lactiferous duct. All these lactiferous ducts converge. These are the lobes of the mammary gland which are formed by the alveoli, small alveoli. These are drained by the lactiferous duct. All this lactiferous duct drains into the nipple. Now, just before the nipple, it forms a dilation which is called as the lactiferous sinus. It forms a dilation which is called as the lactiferous sinus. So, हमारा जो next term है जो हमें याद रखना है, that is our lactiferous sinus, जो कि हमारे पेरेन्काइमा में अपने को देखने को मिलेगा. Lactiferous sinus. At the end of the video, I will revise all these terms once again. So, parenchyma में क्या है? parenchyma हमारा main mammary gland है, which is made up of 15 to 20 mammary lobes. Each mammary lobes is made up of the acini, which are and the mammary lobes are drained by the lactiferous duct. This lactiferous duct forms an dilation towards the end of the nipple, which is called as the lactiferous sinus. Now, this completes the entire thing about the breast what we have to study. The next topic is कोई भी organ है तो उसका arterial supply, nerve supply और उसका venous drainage लिखना बहुत ही ज़्यादा important है उस LAQ में. So, talking about the arterial supply of our breast is highly vascular. This diagram will help you to understand the arterial supply of the breast. First of all, we have the internal thoracic artery, which supplies the breast through its perforating branches of the internal thoracic artery. This internal thoracic artery is basically a branch of our subclavian artery. Internal thoracic artery is a branch of our subclavian artery. So the first artery which supplies the breast is our internal thoracic artery via its perforating branches. The lateral thoracic artery, just a minute. The lateral thoracic artery, the superior thoracic artery and the acromiothoracic, या फिर इसी को हम thoracoacromial artery, which are the branches of the axillary artery. Once again, lateral thoracic artery, thoracoacromial trunk and the superior thoracic artery, which are the branches of the axillary artery. हाँ, यहाँ पे लिखा ही हुआ है, so the branches of the axillary artery. उसके बाद lateral branches we have from the posterior intercostal artery. Again, ये एक डायग्राम याद रखो, सारे के सारे जो है. अब तुम्हारा अभी तक जो है वो thorax region हुआ नहीं, वरना this becomes more easier, क्योंकि ऊपर से यहाँ से हमारी आती है axillary artery, ठीक है, यहाँ से हमारे पास है अपने internal thoracic artery और यहाँ से अपने posterior intercostal artery. तो उसकी lateral branches, यहाँ से perforating branches और यहाँ से axillary artery के branches. Venous drainage, the veins follows the artery. Remember, जो आर्टरी के नाम है उसको बस वेन्स कर दो, लेकिन वीनस ड्रेनेज इतना इजी नहीं. आर्टेरियल सप्लाई, एक बार थियरी वाला पार्ट देख लो. इंटरनल थोरैसिक आर्टरी, लैटरल थोरैसिक, सुपीरियर थोरैसिक एंड द लैटरल ब्रांच ऑफ द पोस्टीरियर इंटरकोस्टल आर्टरी. Once again, quick revision. The breast is supplied by the branches of the axillary artery, which is the superior thoracic artery, thoracoacromial trunk, and the lateral thoracic artery. Then by the perforating branches to the internal thoracic artery and the lateral branches of the posterior intercostal artery. Moving on to the venous drainage, the veins, अगर हम देखेंगे ये बेसिकली पहले एक वीनस सर्कल बनाते हैं. ठीक है. First converge at the base of the nipple, form a venous circle. This venous circle divides into the superficial and the deep part. Deep part में हमारे पास axillary artery है and posterior intercostal vein. Sorry, axillary vein है and posterior intercostal vein. Axillary vein में वापस फिर वो superior thoracic, lateral thoracic and thoracoacromial veins. और हमारे पास intercostal vein. और बचा हुआ अपना internal thoracic vein. इंटरनल थोरैसिक वेन कौन सा था हमारा? तो ये हमारा जो जिसको हमने मैमरी आर्टरी भी बोला था, तो वो वाला वेन जो दैट ड्रेन्स दी सुपरफिशियल वाला पार्ट. उसके बाद नर्व सप्लाई, एंटीरियर एंड द लैटरल क्यूटेनियस ब्रांचेस ऑफ द सेकंड टू सिक्स क्यूटेनियस नर्व. नाउ एंड वेरी इंपॉर्टेंट क्वेश्चन दैट इज आस्क्ड, दैट इज लैक्टेशन अंडर द नर्वस कंट्रोल? So the answer is no. Secretion, sorry, not lactation, the secretion. The secretion of the milk is controlled only by the hormone prolactin, which is secreted, which is released by the अपना अपना anterior pituitary, तो जिसको pars anterior भी कहते हैं या फिर the hypophysis cerebri. So this completes the basic information about the breast. In the next video, I'll be dealing with the lymphatic drainage, क्योंकि वो भी एक अलग से एक important LAQ है. And in the coming on videos, in the next video, after the lymphatics, after in the next video itself, I'll be dealing with the breast cancer. Okay. So quickly revising all those four terms. First of all, the foramen of Langer. Foramen of Langer क्या है? An opening through which the extension of the breast passes into the axilla. Next, the tubercles of the Montgomery. Tubercles of Montgomery क्या है? तो in the areola we have the modified sebaceous gland which becomes enlarged during the pregnancy. This enlarged glands are called as the tubercles of Montgomery. Ligament of Cooper क्या है? Ligament of Cooper क्या है? तो basically it's the अपना ये अपने fibrous trauma का part है which anchors the skin to the pectoral fascia to maintain the shape of the breast. At the end, we have the lactiferous sinuses, that is the dilation of the lactiferous duct while before piercing the nipple. So I hope that you are well versed with the breast, and if you have any doubts, please feel free to ask me. आर्टरीज के लिए देखो ये भी एक अच्छा डायग्राम है, अच्छा हुआ. ये हमारी एक्सिलरी आर्टरी है, उससे ब्रांचेस है. फिर ये हमारे इंटरनल थोरैसिक आर्टरी के परफोरेटिंग ब्रांचेस, यहाँ से लैटरल थोरैसिक आर्टरी होगी. टिल नाउ तो यू नो इट. फिर ये हमारे मैमरी लोब्स, फिर ये लैक्टिफरस डक्ट्स और ये हमारे लैक्टिफरस साइनसेस. यू कैन वेरी वेल सी दैट दिस डायलेशन इज कॉल्ड एज लैक्टिफरस साइनसेस. और कोई डायग्राम अगर छूट रहा हो एक्सप्लेनेशन के लिए तो नहीं, वापस यही आर्टरी वाला. आर्टरीज याद करने जरूरी है, सो मेक श्योर दैट यू रिमेंबर देम. सो यस, if you have any doubt then please feel free to ask me. You can directly DM me on Instagram या फिर आप comment section में भी डाल सकते हो. I'll surely reply to it. Make sure that you read the text once and you make this topic thorough itself. Thank you. Wish you all the best.